Manish, can we start?
Yeah, we can go ahead. Yeah.
So good afternoon, everyone. I, Radha Pavitra, Assistant Professor, Department of Management Studies, DSCE, welcome you all to Enabling Vein-to-Vein Traceability, Session 2 of TendingTech, a series that aims to shed light on the journey of entrepreneurs. Blood transfusion is the process of replacing lost blood in one's body. As a result, it is one of the 8 crucial life-saving functions in comprehensive emergency obstetric care. Considering women, especially, excessive blood loss is one of the major causes for maternal mortality, especially in villages. There is, however, a need to address low availability of blood in rural areas. And for this, more quantity of quality blood should be available in the nearest blood center to eliminate avoidable maternal mortality and morbidity. Bagmo Pvt Ltd is a healthcare startup based out of Kochi, Kerala, which focuses on solving the healthcare needs of the country using engineering innovations and operation management techniques. It has developed an IoT-enabled blood bank management system, an innovative technology for the supply of blood, and it is a blood supply chain to eradicate the non-availability of blood in the rural parts of India. It gives me immense pleasure to welcome and introduce today's healthcare entrepreneur, Mr. Ashfaq Ashraf, co-founder at Bagmo Pvt Ltd, a part of the TendingTech series jointly conducted by the Department of Management Studies, DSCE, IEDC DSCE, and DERBI Foundation, in association with Social Innovation in Health Initiative, TDR, the Special Program for Research on Diseases of Poverty, and Sida. Mr. Ashfaq holds an MTech in Clinical Engineering from IIT Madras and Bachelor's in Instrumentational Engineering. He has professional experience of 6 years ranging from various places, like for example, the Ministry of Health to hospitals to startup companies. He started Bagmo Pvt Ltd with a vision of making safe blood available to rural areas. His interests are in developing better medical equipment lifecycle management practices in India and developing affordable products for primary healthcare delivery. When not working, he loves to explore different parts of India, especially rural areas. Welcome, Mr. Ashfaq.
Ashfaq, you are on mute.
Hi all, thanks for the nice introduction. And now is it audible?
Yes, now you're audible. Please go ahead. Welcome.
Okay. Thanks for the introduction, and happy to share my views and share my journey with you all, and looking forward for further thing. And I will start with a little bit about my work, and then we'll go.
We lost you again, Ashfaq. We are not able to hear you.
Okay. Maybe, yeah. I think. Yes. It's. I think it's good.
Yes, please go ahead.
Yeah. So I will start a little bit about my company and our work and why we started.
We're losing you in between, probably because of your headphones. Is it possible for you to remove your headphones?
Okay.
Yeah.
Yeah. Is it audible now?
Yes, you're audible now, please.
Yeah. So thanks for the nice introduction, and mainly I will talk about a little bit about my company and my journey, and then we'll further look forward interacting with you all and
Sure,
share my views. And so Bagmo is basically a startup working towards a blood supply chain. So in the current scenario, as you are aware, availability of blood is very poor, and many of us are already experienced that if some of our relative or someone is get admitted and require a blood transfusion, we have to immediately rely on the WhatsApp or our friend circle to get a blood donor for this hospital. But actually, blood should be available like any other product, like any other medicine product. The doctor prescribes and you go to the blood bag and collect the blood. It should be like that. But unfortunately, this is not happening. And the major issue is the supply chain scenario and fear of blood getting wasted And we are targeting that and coming towards first address the supply chain scenario, supply demand map, and how much is required for every hospital. And once they collect the blood, it is a perishable product and it will ultimately go for wasted. So it's a, critical short supply chain, and this is happening at production center, and then it is available in that hospital and nearby hospital as well. And if it is needed, it will be transported to rural area. And if it is not used in rural area, it will be coming back. So it's a small supply chain, and in that the cold chain should be maintained. In the current scenario, since there is no data availability regarding the condition of storage, nobody is willing to believe other people. Like a district hospital will not believe what is the storage condition, what is the quality of blood stored in the rural area. So we are making this data free flow and available to everyone, so that always blood reaching to the patient will be always safe. So that's the main vision. And once we identified this scenario and we started developing a very simple technology which is easily scalable, and that also one of our design criteria, like it should be able to work in a very low resource setting, very low tech manpower it should be able to use. So these are the design criteria, and then we designed, and we also applied for patent. And then we received, in the initial stages, we received a Department of Biotechnology grant, and then at a later stage we also took a seed fund from other institutional investors such as DERBI Foundation as well. And now we are started targeting into different state governments as well as private hospitals. So looking forward for further question, and we will dig deeper and go deeper with the interaction.
Sure. Thank you so much for a very small introduction about what Bagmo does on a larger scale. So what we want to first cover also, right? So is with the belief, with your belief especially, of wanting to increase availability of blood in rural India, that too with the use of technology, right? So would you say that technology is very important for supply chain? And could you like elaborate a little bit on that importance as well?
Yeah, very sure. So even the government have designed these guidelines for this blood supply chain, and people know that these are the things should be followed, they were not able to follow. Many developed countries may be able to follow, like every supply chain there is a cold chain monitor, and then they will note it down, and they have the
You
manpower.
again, Ashfaq. We kind of missed a couple of seconds. Could you please repeat?
Yeah, yeah. So basically, even though the government guidelines are there for the supply chain, many are not able to follow. In the developed country, this is the scenario is different. They have qualified manpower, they have sufficient manpower, and their service area is very small, not like a large population, not like a large area. So these are some of the advantage developed country are able to advantage. So mainly they have multiple manpower. So in a country like India, these are not happening. So the supply chain is not working properly. Whatever we vision, that kind of idea. When I talk with a very senior entrepreneur who was an ex-IAS officer, so he said that 20 years back, I talked to the same idea without the technology, with the same vision they are having without the technology. But the problem is that is not able to implement in a small, low resource setting like in India. But when the advantages of technology and when the technology is bringing the scenario, we can ensure the quality and smoothness in the supply chain very easily. And that I think technology is one of the major components in the supply chain, especially in the current scenario, and where data is more easily accessible. And even though there is a lot of change inhibition is there, but still people are able to see the value what we are bringing about the supply chain and about the importance of technology using in the supply chain.
Great. So what we also wanted to, kind of look at, right, is because you have created an IoT-based blood bank management system, right? So it's normally always very important that we have to keep on updating any database so that it doesn't become a very extinct sort of a database or a stagnant database, right? So we normally always work on constantly working and, constantly updating this, right? So how do you go about, this process? Does technology or anything else help you with this constant upgrade and constant, new additions to your database?
Yeah. So One is like how the tech stack help us to easily update the solution, easily update the database. So currently we use a large amount of data. Every 1 minute temperature data will be pushed to the cloud. And how do we manage these things? So basically we use a language Python, and the software team have developed a very fantastic system so that the data overflow will not affect our system and will not affect the speed of processing any data points. So this is the technology is currently able to deliver many things like such as the huge amount of data in such items. And this is how in the technological way how we are coping up with the large number of data. And regarding that, how are we means any new addition in the future, and every customer have a different opinion. So what we follow is what is the best standard available and what is the national and international guidelines says, and we are trying to align with that, and then educate that to the our customers so that they will be able to grasp what is easily able to follow with their process. There is any change or any process change, every section of our software also in a modular ways, so we can always map into different sector and coming back to main flow of software. These are the some of the advantage we are offering in the current using the technology. Hope I answered your question.
Yes, definitely. Yes. So normally what we also look at is identifying the right talent, is quite hard, right? So it's not something that's very easy. So especially for startups, this becomes another challenge altogether, right? So you have to identify the right kind of people with the right talent, and especially the passion as well, right? Because for startups, passion is very, very crucial, right? So the team that you have assembled, right? How did you go about the entire process of, getting them assembled and, starting your journey as well?
That's the tough question. We are not yet able to track or any idea regarding how to find the talent. Still struggling to find talent within the strict budget of startup, as well as there's no many people to identify the talent as well. So bigger company have a certain separate HR department who can track and bring talent and constantly. But startup, it's a tough challenge, and we are still facing. We started earlier in Bangalore, and then identified that getting talent in Bangalore is a little bit difficult with the strict budget of startup like us. So we moved to Kochi. There also we think that uh, we were able to easily attract the talent, but retaining the talent again is still challenge. And the initial team was luckily we got good people, and they're still staying with us. A few members, like finger countable numbers. So they are staying with us, and they are still. And another thing we are seeing is that as a not as a startup founder, as a person, I think that. We are able to get freshers and allow them to explore themselves and give the complete freedom whatever they want to work. And even though we are having many ideas, but still we will pick the idea from the youngsters, and then once they get into the track, and within 6 months to 1 year, they were able to land into other jobs, and they gain the confidence in applying for other jobs. So this is the one of the fantastic thing, and we will keep in touch with most of our previous employees still in touch, and they are well wisher, and they are happy what we are doing. So these are the some of the best moments, and getting the talent is always a challenge. No idea if any of you have some idea, I'm open to hear that.
So because you said, finding the right talent is a challenge, right? So could you elaborate on what do you look for when you say, you want to hire somebody? What are those, specific characteristics that you look for in a potential hire or a potential employee?
So basically the attitude towards the work, and at present we are not able to assess that. So even though we think that it's a bad hire, but later they will start picking up and they will easily start learning. Only thing is that self-initiation and their ability to work, see that work. So if they are not seeing it as a 9 to 5 job, and I have to do whatever I have to, whatever the boss said or the team lead said, then it's not a good hire or a good working method for a startup. So it is like you interact with everyone and you understand what should be done, and then you yourself will start doing without any team leads support. That's the kind of people we are looking, and self-initiation and ability to convey whatever they are doing. So if there is any roadblock, people have to inform the next immediate supervisor of their work. So attitude is the main thing, and the common sense whoever is having. So suppose we are hiring for a software coding, so we will check whether they have a coding sense or how they are approaching this thing, the coding attitude. And if you are hiring for a uh, um, electronic system or embedded system developer, so we will look for technically we will look for their theoretical knowledge and their ability to assemble the product or do the engineering works. But we are not able to identify their uh, attitude towards the work. So there are methods I have seen, but we are not able to assess. Only thing is that by having an more interaction or 2 or 3 levels of interviews, we hire them, and then many of them will start continue give a good attitude. So what I mean to say that the attitude is the main thing what we are looking for any work, and it's not their experience, it's not their whatever there in the resume. It is mainly the attitude and their initiative to the completing the work. You are mute.
Because everybody in the world has gone through COVID, and it has affected them in some fashion or the other, right? So could you say about a little bit about what challenges you faced during COVID? Could you share some instances and like how you overcame those challenges?
Yeah. So during the COVID, it was tough for 2 years, and mainly what we did is we some of the employees left, were not able to continue, so they left. Other people stayed with very minimum payment, and we reduced the government was giving some incentive for the office rental and other things, and we were able to complete one of our major installation. So one advantage we got is during the COVID, the hospital cases were very less, and the blood bank where we installed our system, the first installation in the government set, they were very open, and we were able to interact nicely. And that's the first installation, and we got complete dedication from the staff during that time. So that's one advantage in the cash flow and other thing we got, and we stopped marketing completely during the COVID time, and that's how we sustained. And later we started picking up, and last 6 months only we started the marketing again.
Right. So what I also want to kind of know, and I'd like I think even the others would also like to know is, like, could you talk about a little of the milestones that you've achieved so far in your entire journey?
Yeah. So before we starting, the milestone was like whatever the work I do, it should be continued. And when I interacted with our mentor, professor from Christian Medical College, Vellore, what I suggested, what I proposed is that I will start working on this project, and I wanted to know complete scenario. And he was able to tell the past scenario, present scenario, and what might be the future scenario. That's how we developed a solution which is fitting a technology solution. From the clinical perspective, we got a completely different idea and mentorship. So what I proposed is that I will deliver whatever the work I do, and then in the initial stage, the major milestone was uh, telling people that this is the problem, it is existing, and you have to start addressing it. So even though government is working with the falsified data, many only positive data is normally published. Many negative data will not be published. And as you are aware that this, even in the population register, even in the COVID death registration, there's lot of data mismatches there. And this is one of the major challenge we are facing. And how we achieved in the initial stages, we approach different health officials and tell them that there is a scenario, and this is how it should be addressed. And it was they were not able to believe. And we approached for grants and all, and they will tell that, so this is such a simple solution. uh, is uh, is it only thing to be done for the blood banking? So we were persevere, and we were approaching frequently, and some of the major grants we were able to crack in, and that's the one of first milestone we achieved. So cracking into government grants and kicking off the pilot study or the field installation. So the second, as a second thing is that we immediately, as within 2 years, we deployed our solution in one of the hospital, and then again we started improving the product. Like in the initial stages, the mentors were telling that there's a lot of bugs and there's a lot of things to be done, even though it is not a perfect system. Still, you have to release and get the feedback from the field. Like in Microsoft, Microsoft always release the product with a lot of bugs, and later they will start giving the updates. So this is the scenario. In the earlier days, at least, Microsoft will have a lot of bugs. Still, people are able to use because of its scalability and ease of use. Same thing, we are also, one is the another third milestone we achieved is we immediately cracked into the field installation and start working on it. And as a third milestone, fourth milestone, we did was getting into a pilot study grant, and then getting into a government innovation agency collaboration. That helped us to reach into government. And when you approach the government, major challenge is that the health officials or the doctors, they have to bear the contingency. Like at a later stage, if they asked why did you use this technology, if there is any mismatch, so there should be some way to take out the authority or the representation of this technology. So that have taken by a innovation agency separately. So that was one of the lucky moment for us. So that's the fifth milestone. And then we started getting into acceleration program and scale up activities. So that's still going on, and that's as a last milestone. So every last 5 years, this is the some of our journey. Being a hardware startup, I think the startup journey is little bit extra, and when you are targeting a social cause and a social entrepreneurship, so it's a little bit longer than normal IT startup companies.
So continuing on what you said, right? So with you being a hardware startup, right? Do you face like a lot of competition, or like who would you say is like your competition? Do you see somebody like as a big competitor? What do you think you can do to probably tackle them, if for example?
Yeah, as a competition, I think many of the established companies, so their way of working or way of seeing is different. And once we have a good product and good field installations, then I think we will be able to collaborate with bigger companies or easily acquired by any other larger company. So these kind of challenges are not a problem at the initial stage. Only thing is that we will should be able to uh, 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 crack into the field installation, at least initial users for our system. That's the main thing for seeing the or fearing the challenge in the initial stage. But direct competitors might be there, but you have to have a different distinction between that company and your company or your offering. Hope I answered.
Noted. So what we also want to look at is on a personal front, right? What kind of legacy do you want to leave behind in the world?
Yeah. So that's when I joined for the Ministry of Health, my boss was telling, you work on a small part of a policy making. You and there my work was in the vaccine supply chain, and I contributed towards how India can make affordable vaccine products for in the rural areas, and how it should be maintained properly. So these are some of the targets. And during that time itself, I was thinking that at a later stage, after 10 years, 15 years, you are seeing in a rural area the availability of vaccine in a proper cold chain. Similar way in the current scenario, after 5 years, 6 years, we are if I am seeing blood availability in many areas, I will be happy and I want to leave that. So technology can make an impact and it will be available. It should be available and it should be usable. The benefit should be reached to the common man, and I want to leave that as a legacy. How technology can be applied to the bottom of pyramid.
Right. It's a very, honest and very, I would say, yeah, it motivates others as well, the legacy that you'd want to leave behind. So what I think is we can probably open up the session to the audience as well for question answers. So the audience, please make sure you can either unmute yourselves and ask any questions that you'd like to ask Mr. Ashraf, or you could also probably put it up in the chat box and we can read it out so that he can share more insights as well. So Ashfaq, while we are waiting for the others as well, right? So I have a personal interest as well to ask you, right? So what I want to understand is, so quality is something that we always expect from any kind of product or service that we get or are given, right? So how important does quality play in your service that you offer, and what is your take on say quality in supply chain?
So quality always people fear, and the management or the whoever is spending money, they are always afraid. Let's do it at later stage, uh, or after some time, and they are not understanding what we are burning is actually fighting against a lot of friction. Quality actually remove the friction and make the system run smoothly and reduce a lot of chaos. So especially in the blood banking sector, the chaos is much higher, and the question may even come back at a later stage, questioning that life of a person. And this is something the blood bank officials understand, and they're easily able to tell that we need a proper quality management system, and using a technology such as Bagmo. And the blood bank officials are interested in taking or started absorbing our product into their supply chain, into their product pathway. So I believe that implementing quality actually reduces a lot of friction and will avoid any chaos. At a later stage, suppose a patient have got some reaction or patient death might have happened, and then the question will come towards that the blood bank was the blood bag given was not good quality. In that case, they should be able to provide with a proof and data saying that, see, we have taken these kind of quality inspection and this kind of data is already there to ensure our quality supply chain and ensure the safety of the blood bags. So quality is always important in every sector in the health supply chain and the health system.
Right. Bharat Gautam, you have raised your hand. Can you please unmute and ask your question?
Yeah, good afternoon, ma'am, and good afternoon, sir. I have a doubt. So, does the supply chain have a strategic importance, sir? I just want to know, is there any strategic importance or like thing in a supply chain? And do you have any plans to make it more optimized, sir?
Yeah. So blood is have a perishable high value product, and there is no alternative. If you waste a lot of blood in a blood supply chain, the people might question, and the government officials, district collector may question why there is so much waste. But wastage always happening, and always the inventory also should be maintained because it's a life and death situation. If blood is available, lot of death can be avoided. So there's always a lot of dilemma in the blood bank officers how to make an optimum inventory for their blood. And one of the major challenges is what is the actual usage of demand. And we are planning to be already associated with a government organization to map the supply and demand, and what can be the modeling and the simulation can help in reaching to a good inventory model for any blood banks. So we have started this work, and this is the one of the major thing to be addressed in the current scenario. And regarding your other question, how what was the other thing?
So his other one was, do you have any plans for optimization or yeah, to make your product more optimized?
Okay. So the optimization is basically this supply and demand mapping, and tell that whenever any donor walk in, and the doctor, the support system should be able to tell them that, okay, we have enough O positive blood type inventory. So you come back, you book a slot in the next month and come back next month for the donation. This should be able to tell. In the current scenario, the only with the intuition and lot of experience, they were able to tell that. We are bringing in such a system that this is the optimum level of inventory.
Right, thank you so much. So there is a question from Professor Yuvraj Halage from the Department of Management Studies. He says that it was a good session, and he asks if you can throw some insight on new age skills that are needed to work in your industry.
Okay. So from the technological perspective, different skills like new age technology such as React, Java, and MERN-Stack, these kind of things are helpful. And from a startup perspective, we always may not go with the certifications. If the candidate is able to tell that I have undergone a online course and completed these are the courses, and I'm confident in the theoretical knowledge, we will be ready to accept them and try with the real world scenarios. And in the other sector like management side of the company, I think major thing is that whatever most of the concept we should be implemented or we are following is already there in the industry, and in the different styles people are following operations in the different style. And the skill set people wanted is that able to understand what other companies are doing or what other startups are following, and how that different methods and optimize for a startup like ours. So management side people should be able to understand what is the current status of startup and how the capabilities of different people, and design especially the policies and management activities regarding that based on the available knowledge. And they should be able to, they should not be expecting that a senior manager will come and tell that these are the things we are following and these are the things you should be start developing or you should be start implementing. So this is the not the scenario. And agile methodology and other thing, I think most of them are aware, and people have to should be able to follow that. Hope I answered.
Right. So Ashfaq, one question that we normally see, right? So we always aim for getting newer technology, newer, infrastructure, anything that will always help us to keep on growing and improving and being the best versions of ourselves. So what I want to ask you is, do you foresee any kind of infrastructure or technological changes, or even the change in, say, the psyche or the psychology of people, how they look towards, having blood banks and their perspectives and mindsets? So do you foresee any kind of changes that you think you should have, you should get it, or anything that you would like to have as well?
So we always try to be in the forefront, and whatever the new technology, whatever the new methodology people are following or available in the current market, we try to grab that. One of the examples is that we always use the latest Amazon Web Services protocol for our technology, and we use the latest IoT communication protocol, our system. So these are the things we always follow in the technological perspective. And the people perspective, different mentality will be there. People always ask, oh, they have that technology, have that facility, and this technology have this facility. Why can't you make that? This kind of observation will always be there. But we have to be strict on the development plan and strict on the delivery of the product, and they give the product in a tested and secure way. So that's always our priority, even then adopting any new technology or adopting any new features into the system.
Sure. What I would also want to, you might not be able to give us like the complete details of this, but do you have any other plans for, extension in, in your current products, or do you have any plans for new products to be launched, anything like that?
So we are working, we already applied for patent as well. A machine learning based complete end-to-end tracking for any vaccine supply chain, any cold supply chain, be it for the meat, be it for the pharmaceutical product, or be it for the biological products. So we want to work on that. That's an R&D project. We are working a bit slow in that regards.
Right. So what I also, because you did mention, biological, cold, a lot of different supply chain terminologies, right? So what exactly is the difference? So is there a difference in product, if it's a blood, management system, if it's a vaccine management system, if it's, any other form of cold store management? Is there like any difference that exists, like very prominent differences?
Yeah, the different. So mainly our focus is in the perishable sector, like which have a certain lifespan, and in the initial stage, the value of the product also is targeting is very higher. Like blood is a very high value perishable product. Similarly, many other products are there. So in the initial stage, that is the target. And how the supply chain is different. Now, suppose mainly from the production to the final user, what are the chains it has undergone? What are the differences in each sector? For example, the blood is manufactured in a district hospital and transported to a rural area 20-40 kilometers away, and it is consumed over there into the patient. But a vaccine, it have a different supply chain. It is manufactured, suppose it is manufactured in Pune, and then it is stored in their factory premises, and then it is packed in bulk, and then it is transported via air, and then it is stored in a large warehouse, and then it's stored. So these are the many, around 8 sectors are there, 8 segments are there in that supply chain, vaccine supply chain. And every sector, the demand and the challenges are very different. Last mile challenge is entirely different for the vaccine. But the blood banking sector, the last mile is very different. So every supply chain, different opportunities and different challenges are there. And if we are targeting a different segment, we have to completely dedicate it, and the solution should be able to work after understanding what is their requirement, what is their challenge, and how our technology can support that. Majorly, many of the technological scenarios might be similar, but the application should be feasible and easily usable in each scenarios.
So considering the fact that you work with a lot of different hospitals and different settings, right? So how do you go about generating leads? So how do you have a discussion with a potential person that you'd want to partner with? What kind of details would you be letting them know? What are things that you look for to have in a potential partner?
Partner means a client?
Yeah, so like a client, yes.
Okay, great. So basically, we identify, try to push initially basic product details, and then we'll check with what is their major pain points. So, a technician pain points are different. A doctor, a medical officer pain point are different. And in the blood banking, the counselor is there who counsels the donors, their acceptance for the blood donation. So their perspectives are different. So we try to propose them, each of them, different aspects of the product and different use cases. And then ultimately, once they love the product, and we have to show completely a different scenario to the management, especially who is in the purchasing power. Like how much time this product can bring the return on investment for your hospital, or how can it make safe blood for your patient. So this is the scenario for their purchasing department. So these are the different set. And we also see that if they have the purchasing parity, purchasing power for that particular product, if it is not there, we will keep it for a separate discussion, or we also offer different payment options and all. So these are the scenario we always seek for our clients, and we start filtering as well. Hope
Right.
you.
Yeah. So any like, do you have like what was or what is your most challenging client that you've dealt with?
Most challenging is always government.
Okay.
It will always take time.
Could you
So,
tell us why it's very challenging, if you don't mind?
yeah. Majorly because these health workers, so they are coming from they have that feeling that whatever they deliver, they don't need to improve actually. So they will always try to stick with whatever is the method currently they are following. And uh, so making them understand that these are the things ultimately going to benefit you is one of the challenge. And then they will go for, the government departments will go for everything, so many levels they will follow. So every level we have to convince, and they will get the paperwork done, and then it will come down. Only thing is that they will easily understand, but the time delay for every step is a bit time consuming. So if it is coming through a higher official, and this will work quickly. And one example is that we were able to waiting for the permission from a health secretary, uh, IAS officer, and not able to get that. So finally, one day we directly went and met with the doctor, met with the health secretary. So we got easily the permission, and he himself called and inquired, asked every table to move the paper so quickly. So these are some of the things we experienced, and it's always how grit can you show them, and how are you here for staying. That's what they check.
Right. So considering the number of challenges or the difficulty in terms of the paper pushing and all of those things, right? So a lot of people might hesitate before entering such a field, right? So it does take a lot of grit, like you mentioned. It takes time, passion, a lot of effort and energy as well. So what kind of message would you say, or would you like to tell people who want to get into the industry, want to get into, say, found start a company fresh, but they're a little hesitant because of, so many of the negatives they might have heard from other people?
Yeah. So basically, it is the journey that will enjoy. Uh, so every day is a new challenge, and you'll start enjoying after some time. And sometimes it will tire you, it will break you, but again you will come back with a solution. Every day you will see different challenges. One day it is an HR challenge, and next day it is a hiring challenge, or next day it is a firing challenge. How you will tell to the people, or another day it's a tech challenge. So always every day with a new challenge, and it's very interesting. And the journey is what means you will find a lot of friends and a lot of people in the same direction. It's always nice with the journey, and every day is a milestone, and every day we are solving something. So it's not the final goal, or it's not the final success, but every day is a challenge, and it will equip you with a lot of capabilities. And that will ultimately, even though the startup is a fail, ultimately but the startup founder never fails. He always wins. So that's the message I think I can share.
Right. So any last questions that anybody else would like to ask of Ashraf? So would you like to share anything else with us, Ashfaq? Any message, any tips, anything else that you'd like us to keep in mind, anything like that?
Means if anybody means want to get in touch, I'm always open for any discussion or any inputs from my perspective. And I always think that in the health sector, the management science can do a lot of things. In the current scenario, it's very sad to hear. For example, a very expert doctor is who lot of patients are waiting for him. Lot of a pediatric surgery department who have a lot of, he is very good with his fingers in operating any cancer and removing cancer. The same doctor is doing the planning as well, and talking with the different department and scheduling the surgeries. And these can be avoided if a lot of management expertise and operation science experts come into the picture. And first of all, the health industry should be acceptable for that. And second thing is that the management officials should be able to deliver what is exactly required, what is the health system wanted. Like should be able to understand the terminology, should be able to understand the criticality of the scenario. I think to the management students available here, I think there's a lot of opportunity in the health sector, and start exploring that. Uh, other than that, I think nice interacting with you, and happy to share my thoughts. And thanks for this opportunity.
Thank you so much, Ashfaq. So it was a very great honor to share this platform with you today. And thank you so much for taking your time and sharing your experience with us. You've given us a lot of insights that I'm definitely sure all of our students and other audience members can also be, looking at as well. Right. So on behalf of the Department of Management Studies, Dayananda Sagar College of Engineering, we thank the management of DSCE and the principal, Dr. CPS Prakash, Dr. Lakshmi Jagannathan, CEO at DERBI Foundation, and the team at DERBI Foundation as well for their guidance and motivation. Our beloved HOD, Dr. KG Hemlata, for giving us this opportunity, and all of our faculty members for their constant support. So thank you all for joining us today, and we hope and we shall be definitely back with the journey of another entrepreneur as well. So please stay tuned and have a great day, everyone. Thank you so much.